Good morning and welcome to Common Sense Matters, a program sponsored by the Franklin County, Tennessee Democrats. I'm Sandra Rice, and today our topic is Medicare Advantage, and my guest is Dr. Carol Paris. Let me make a few announcements first about party business. Our meetings are the fourth Tuesday of every month, beginning at 6 p.m. at the Franklin County Annex. But our next meeting will be on Thursday, April 25th, because of room scheduling problems. Our email address is Franklin County, Tennessee, Franklin County, Democrats@gmail.com. Our Facebook page is Franklin County, capital T, capital N, in parentheses, Democratic Party. Our website is Franklin County, Tennessee, DemocraticParty.com. You have to put Tennessee in there because everybody's got a Franklin County. It's important to log in to our resources this year because it's an election year for many state elections, not just the national races. For example, Rosemary Drake is a candidate for state Tennessee House of Representatives District 39, currently held by Iris Rudder. There are several upcoming fundraisers. The first is on April 15th. State Representative Gloria Johnson is a candidate for U.S. Senate seat currently held by Marsha Blackburn. Mark your calendars for June 15th for a fundraiser in Winchester Park. There are two other candidates for U.S. Senate, Sybil Miller Watkins and Marquita Bradshaw. Look again at our sites for information about fundraisers for them and them visiting us to tell them about their plans. So let's start talking some common sense about health care. My guest is Dr. Carol Paris. She's a retired physician and past president of the Physicians for a National Health Program. Now, I've known Carol for many years, beginning with the fight to save the Affordable Care Plan, or Obamacare, in 2016. Remember that?
I certainly do.
It was going to be replaced by our former president by something beautiful and wonderful, but here we are in 2024. But still, I learn almost every week of something that Carol has done all over the world to advance equal access to quality, affordable health care for all. Welcome, Carol, and thank you.
Thank you, Sandy. I wouldn't say all over the world. Maybe, hopefully,
well,
all over the country.
Counts
oh, well, actually, that is true. I lived in New Zealand for a year from 2013 to 2014, and I worked there specifically as a physician because I wanted to work in a country with a national health program so that when I came back to the United States and continued to be an outspoken critic of our non-system of healthcare, I could say, I'm not just blowing smoke. I've actually worked in a country with a national health program, and guess what? It isn't perfect. Nothing is perfect. It's just so much better
For more people
than what we do in the United States. But today you wanted to talk about one aspect of our healthcare system.
Kind of the latest thing, the latest buzz is Medicare Advantage. Can you tell us what's different between that and regular Medicare?
Well, we've just finished the open enrollment period. I imagine many of the people listening remember getting their mailboxes filled with advertisements that sometimes didn't even look like advertisements. They looked like they were actually
Health insurance.
health documents from Medicare. And it isn't until you read the fine print that you realize that what you have in your hand is an advertisement for a commercial insurance plan that is selling a Medicare Advantage plan. So I think the first thing to understand for listeners is that traditional Medicare, which is the Medicare that was passed in 1965, the Medicare and Medicaid Act, is a government-financed but privately delivered program of health insurance for senior citizens and some people who qualify with various specific disabilities. And the thing about traditional Medicare is that when you think about it, it is financed by the federal government. Does the federal government have an obligation to make a profit, Sandy?
Well, you didn't tell me there'd be questions. No.
The federal government does not have a responsibility to turn a profit
Or share it with stockholders.
and share that profit with stockholders.
They have a responsibility to use our taxpayer money efficiently and wisely.
efficiently, and that is really important. So private government-financed traditional Medicare has a responsibility to deliver the highest quality care as efficiently and cost-effectively as possible. And so traditional Medicare actually operates on conservatively a 3% overhead. That means that when taxpayers contribute in their paycheck to the Medicare Trust Fund, only 3% of the money that's collected is used for overhead. That means 97% of the money is going to actually delivering care.
Okay.
Okay? Now, that plan is what we had from 1965 when the law passed until sometime in the 70s when the concern was that the government might not be as efficient as industry, as commercial insurers at delivering cost-effective care. And so they started this experiment that at first was called Medicare Choice or something like that. But it morphed into Medicare Advantage plans.
Okay, in the 70s, okay.
And what Medicare Advantage is commercial insurance. The biggest insurers of Medicare Advantage with the largest number of insured lives are United Health, Cigna, and I think CVS. In fact, United Health Group is number 5 on the Fortune 500 companies. Wait a minute.
Yeah, wait a minute.
What does that tell you?
They're making money.
They're making enough money to be number 5 on the Fortune 500. So I hope that's giving people
Pause.
And I want to stop here and say something that I really meant to say at the very beginning of this chat. And that is that I am not criticizing anyone for choosing a Medicare Advantage plan. If you're listening and you're on a Medicare Advantage plan, please don't interpret anything that I say that's critical of Medicare Advantage as being critical of you for choosing it. I understand that many people, in fact, more than 50% of Medicare eligible enrollees are now choosing Medicare Advantage. And if you look at that statistic, it would be natural to think, well, they're choosing it because it's the better plan. That is actually not really necessarily the case. So, yes, people are choosing a Medicare Advantage plan, and they're choosing it because, in most cases, at the time that they're making the decision between traditional Medicare or Medicare Advantage, they've just entered retirement. They're looking at a fixed income, perhaps. There's lots of financial worries at the time of retirement. And so I think people are saying, well, I want to try to be I want to be careful with my healthcare dollars. And so they look at Medicare Advantage and at all the commercials.
I was going to say, they hear the most
They
about
hear
it.
the most about it.
Regular Medicare doesn't send you stuff.
No, they don't. Remember, we said Medicare Advantage is traditional Medicare operates on a 3% overhead.
So they're not going to send you mailings and glossy pictures and
no, they're
healthy,
not.
happy people.
In fact, they're also not going to take out a Super Bowl commercial in 2023. Medicare Advantage had a Super Bowl ad. Mm-hmm. Folks, that's your taxpayer dollars at work.
Wow.
So I understand that people may choose a Medicare Advantage plan because those glossy ads tell you that you can get Medicare coverage for little or no premium and with some little added extra benefits like vision, dental, hearing, and sometimes a gym membership or a debit card for groceries. Well, now you got to think about how useful all those added benefits really are. Do people depend on insurance to keep them from going bankrupt from eyeglasses?
Okay. Uh-huh.
Or
now the dentist, you could.
Oh boy, do I ever know that for sure. But actually, people really depend on health insurance primarily when they become seriously ill, and those costs can be astronomical. Mm-hmm. Mm-hmm. That's where you want to be sure that you have the option if you suddenly find yourself diagnosed with cancer or a serious neurologic condition. You want the choice of the best doctors and the best hospitals to treat those conditions. Mm-hmm. And the trade-off that you made as a relatively healthy 65-year-old who says, well, I'm going to go with this plan with zero premiums and that gives me a little bit of money for dental and vision and hearing and a free gym membership. You make that decision as a healthy 65-year-old, but suddenly you're 75, and does anybody plan on getting cancer? Does anybody plan on developing Alzheimer's disease?
Yeah, and these are, yes, catastrophic illnesses, and I think as a human tendency to think, well, I'm not going to get that.
Right.
Even though it is beyond your control. But think about heart disease. We all forget about heart disease and how devastating that can be, or just, high blood pressure and all the end organ damage that can do. Sorry, right. That was used a medical term, trying to impress Carol. But look at your family. Nobody lives forever. Sorry.
Yeah, unfortunately.
some of that is hereditary, heart disease, diabetes. We know that there's a big increase in diabetes expected because of our diet and our weights. That you cannot only have to fear or be concerned about a big diagnosis like cancer or neurological disease or Alzheimer's, but these little chronic illnesses that can, expand into more.
Right.
That will just come and just look at your family.
Right. So that's the point at which the details of what your plan covers and doesn't cover and how it operates, that's when it really matters. And what we are discovering is that this profit requirement, it isn't a profit motive. Commercial insurance companies have a fiduciary responsibility to turn a profit for their shareholders. That is their job. First and foremost is to make a profit. Mm-hmm. And in Medicare Advantage, there are some they're not illegal, but they are awfully questionable practices that Medicare Advantage plans engage in to increase their profits. And here's where we're going to have to start getting into some weeds, and I hope people's eyes don't glass over. I'll try to make this enjoyable or pleasant or funny. But
that's why I give all the addresses and resources for the party at the beginning.
Well, unfortunately, it becomes really confusing. And, I'm 71 years old, so I had to deal with all of this when I turned 65 too. And it is confusing because if you stay with traditional Medicare, it isn't, you got to pick Medicare Part A. Well, you get Medicare Part A. That's hospitalization. Mm-hmm. That just comes by virtue of turning 65. But then you've got to choose a
B or...
well, you sign up for Medicare Part B and you pay a premium for that. And then you have to pick a Part D drug plan. Mm-hmm. Mm-hmm. And I am not going to pretend that traditional Medicare is the end-all and be-all. It has a lot of flaws.
And it's not free.
It's not free.
Pay into it.
And even if you sign up for Medicare A and B and D, built into traditional Medicare when it was first legislated are all these deductibles and co-insurance and things that are uncovered, and there's no out-of-pocket cap on how much you could end up paying in co-insurance and other uncovered things in a year's time. And so 90% of people who are on traditional Medicare also purchase what's called a Medigap policy, which is commercial insurance that covers all of the things that are uncovered in your traditional Medicare, the 20%, mostly the 20% copays. So for someone who is choosing traditional Medicare, that can be expensive. You're paying your Part B premium, you're paying a supplement, and you're paying for a Part D drug benefit.
Now, if when you talk about, like when you were in New Zealand, a national health program, their taxes are very much higher, so that they don't have all these. So you're paying one way or another.
That is correct. That is correct. But everyone in New Zealand is covered. whereas we leave
Many.
many out. So that's the problem with traditional Medicare, is that it's been in existence since 1965, and we haven't really brought it into the 21st century, and that's one of the things that is that we're working on legislatively now, is to not only rein in the abuse and profiteering in Medicare Advantage, but then to use that money to improve traditional Medicare. Because what we'd really like is for people to be able to just choose Medicare and not have to have a Medicare supplement and a Part D. We could make traditional Medicare as simple to sign up for as Medicare Advantage. We could do that. And the Biden administration is working to rein in some of the excesses in Medicare Advantage, and we'll talk about that in a minute. And there are lots of people like Physicians for a National Health Program and Be a Hero and Social Security Works, lots of organizations that are encouraging the Biden administration to do more to improve traditional Medicare so that it's just plain easier for people to choose it.
Does Medicare Advantage pay for medications?
Most Medicare Advantage plans come with a Part D premium. Come with a Part D included. But again, the devil is in the details. So let's talk a little bit about what some of the shortcomings or problems are with Medicare Advantage. If you choose a Medicare Advantage plan, the first thing you are agreeing to is a limited network. And what that means to those of you who don't live, eat, and breathe healthcare reform, because I know all these terms get mind-bogglingly confusing, but in short,
whether you get your doctor or not.
A network is a panel of doctors that are that you're allowed to see. So say you're 65 and you decide you need a primary care provider because you have switched to a new plan. You're now on a Medicare Advantage plan and you've switched off of your employer-sponsored health insurance. So first thing you have to do is pick a primary care provider, and so you have to go to an in-network provider. And sometimes you will find that network of providers is not as robust as you might hope. With traditional Medicare, almost every doctor and hospital in the country accepts traditional Medicare.
Well, I believe this was a big rallying cry against Obamacare, is that you couldn't pick your own doctor. Is that how you remember that battle? That was a big thing, and now it doesn't matter. It doesn't seem to matter so much. A lot of people don't pick their primary care when they turn 65. They've been with someone for quite some time.
Right, if they're with traditional Medicare. But if they go into a Medicare Advantage
before they go
plan,
into Medicare.
Right.
Yeah, so they might want to stick with the doctor.
But if you want to stick with your doctor and your doctor doesn't accept that particular Medicare Advantage
it's a disadvantage.
plan, then you are needing to find a new provider.
Which might, in a rural area like we are, may not be across the street.
Exactly. So
literally, we're across the street from the hospital.
Yes, we are. So that's the idea of networks. And so you can have a network for providers, for specialists, for hospitals, and with Medicare Advantage, those networks can be limited. Now, again, if you're a healthy 65-year-old who's absolutely delighted that you can finally get a free gym membership, you're healthy and you're working out, and you don't have any health problems, who cares whether the network is limited or not? And actually, that's a significant number of people. You know, you don't turn 65 and automatically start having problems. However, the likelihood that you're going to be 75, 85, 95 and still using that gym membership and not needing to see specialists becomes diminishingly less likely. So then having some choice of doctors and hospitals becomes more important. But here's the biggest problem, as I see it, with the decision to choose a Medicare Advantage plan. And that is that when you find yourself in a situation where you want to see a doctor or go to a center of excellence, cancer treatment center, and you find out it's not in your Medicare Advantage network, you're free to go back to transition back to traditional Medicare.
Oh, you can. Okay.
You absolutely can go make a change back to traditional Medicare with all the flaws that Medicare has by way of all these, 20% copays that are baked into, unfortunately, our Medicare program until we improve it. What you can't do is purchase a Medigap policy to cover that 20%. Oh. And the reason you can't do that is that is the one area where insurance companies can still require you to go through what's called underwriting. And that means that, say you've now developed cancer, you want to go to a center of excellence to treat your cancer. It's not in your Medicare Advantage network, that hospital. So you say, well, I'm going to switch back to traditional Medicare. But you're going to need a Medicare supplement to cover the 20% that Medicare doesn't cover, because when we're talking cancer, we're talking sums of money that can bankrupt a person. And now you go to an insurance company and say, I'd like to purchase a Medicare supplement policy. And they say, well, fine, do you have any health problems? And you say, yes, I have cancer. And they say, no, thank you. We're not interested in covering you. Or they might say, well, we'll give you a policy, but it won't cover your cancer. Or they might say, well, we'll give you a policy and we'll cover your cancer, and your premium will be
$5,000 a month.
$5,000 a month. So in other words, you're essentially not able to make the switch back to traditional Medicare. And that is true after you have been in Medicare Advantage for 1 year.
Oh, goodness gracious.
So in the first year, if you choose a Medicare Advantage plan, and you decide within that first year that you aren't happy with it and you want to switch to traditional Medicare, during that year you can make the switch, and you can get a Medicare supplement, and you do not have to go through underwriting.
Okay.
Okay? And that's true for anyone at age 65 who chooses traditional Medicare, at that time, you can get a supplement. And even if you have cancer, chronic renal failure, you're on dialysis, and, you're wheelchair bound, they cannot make you go through
can't.
underwriting. Mm-hmm. And so your premium will be the same premium that a hale and hearty 65-year-old would have.
Wow. Okay.
So,
well, that's sobering, isn't it? I have traditional Medicare. I've been pretty happy with that.
well, I am too. I'm not happy with the fact that it doesn't cover dental. I mean, I'm actually one of those hale and hearty people who, for the most part, the only things I have, the most expensive things that I've incurred since I turned 65 is I need hearing aids, and I've had a bunch of dental work.
Yeah.
Expensive dental work. So I would have been a person who might have benefited
candidate.
From a Medicare Advantage plan. Mm-hmm. But knowing what I know, I'm not willing to trade a small benefit for dental, vision, and hearing for the peace of mind that I have, knowing that if I become ill, and none of us knows sometimes mm-hmm. when that's going to happen, mm-hmm. With traditional Medicare, I know I have complete choice of doctor and hospital, and with a supplement plan, I'm not going to go bankrupt. And that, unfortunately, is not the case with traditional with Medicare Advantage plans.
Do you want to talk a little bit about the profits of commercial insurance?
Yeah, I alluded to that earlier, that Medicare Advantage plans have a responsibility to turn a profit. And the ways that they can do that are that people who sign up for a Medicare Advantage plan, those insurance companies are paid what is called a capitated rate. And again, I know your eyes may be starting to glass over. Oh God, here's another one of those insurance terms, capitated. What the heck does that mean? Well, what it means is that as opposed to traditional Medicare and the way most people think of, you go to the doctor, you go to the hospital, you get a bill, that's the doctor's fee or the hospital's fee, and you pay it whatever the insurance doesn't cover. Mm-hmm. And that's called fee for service. Well, in Medicare Advantage, insurers that offer Medicare Advantage plans are paid a capitated rate, which means for every enrollee, there is an amount of money that Medicare calls the Medicare benchmark. And so let's, just for the sake of a number, let's say the capitated baseline benchmark for an enrollee is, let's say $2,000 a year. So the insurance company that is offering a Medicare Advantage plan gets paid $2,000 by Medicare, and they're expected to cover all of the expenses for that enrollee with that amount of money for a year. And if they spend less money, they get to keep the profit. It gets even a little bit more complicated than that, though, because there's all kinds of things that can change that benchmark number, like an added, they'll add additional money to that benchmark if the enrollee has a number of health problems. And so what happens is that insurance companies will, Medicare Advantage plans will try to,
Cheapen care.
well, no, the first thing they'll do is try to make their enrollees look like they're sicker than they really are by padding them with added diagnoses that don't really change their care or treatment, but make them look like they have more health problems than they really do. And for each one of those added diagnoses, the capitated rate, it's called the adjusted rate, goes up. So if you can attract a lot of healthier, younger
Oh, I see.
Medicare
Okay.
enrollees with things like gym
Gym
memberships,
And
And-
mailings.
right, and mailings that are designed to attract younger, healthier even down to whether you get solicited depends on what zip code you're in.
Okay.
So they try to attract the healthiest, youngest enrollees, but still scan through their medical records and try to pick up any additional diagnoses that might increase their adjusted rate so that the Medicare Trust Fund pays them more money, but these particular capitated enrollees don't cost that much. And so
I'm sorry, I think my eyes are glazing over.
sorry. Well, it's a game.
Well, it's kind of-
called cherry picking,
Okay.
and so they cherry pick the healthiest people,
But that may not affect.
and then they try to make the cherries look like they're not cherries, like they're really lemons.
Oh,
And if you can make a cherry look like a lemon, you get paid more money.
okay, but the enrollee wouldn't know that.
Who?
The enrollee.
No, the enrollee is not aware of this. So
I'm relate. Tell me if this happens, because HMO, health maintenance organizations, were something that were real popular in the 80s, where it was similar to this cherry picking. But then when you needed things in order for the HMO to make a profit, they were really limiting the services. There was always a
Right.
question, do you really need that referral? Do you really need that scan? I don't know that the patient was bothered with that the healthcare providers were, and they
That's a
were
good
always trying
point.
to save, a buck here and there. I
Right.
mean, what if an enrollee does get sick on Medicare Advantage and he needs angiocardiogram or angiogram, for a blockage? I mean, would they try to limit?
Yeah, and
some of that
this is a
care?
term that actually many of the listeners may have heard of in the popular press, that denials, prior authorization. Is that?
Right.
I hope that's a term people have heard before. That when you need to have a test done, or you need a surgery, your doctor has to get prior authorization, and that means that the doctor has made a clinical decision of what you need. But that's not enough. Now they have to have the insurance company's permission before you get the test or the referral or the surgery, that your doctor has made the clinical decision that you need. That's called prior authorization.
And this is when, if you, again, the patient may not know this, that the doctor says you need this test or you need to see this doctor, and it seems to take a long time.
Right.
Right, because
Right.
somebody in that doctor's office has to, call someone and explain, someone that's never seen you, doesn't know anything about you.
Sandy, it's worse than that.
May not even have any
Sometimes
training.
it is you may be seeing a cardiovascular surgeon who says you need an aortic valve replacement, and yet the person that that doctor or his office has to talk to get prior authorization might be a pediatrician halfway across the country,
if not the world. Yeah, and so you just feel that there's a wait.
Right.
But it's really this behind
the
juggling
scenes, right? And again, the whole idea of prior authorization, in theory, it was to make sure that unnecessary care was not being done, but it has morphed into a strategy for delaying and denying care. And when you stop and think about somebody with cancer, if you delay care long enough, what happens?
Well, cardiac too.
Lots of different
kidney, renal.
People deteriorate. They may even die before the authorization takes place. So these are strategies that these plans use to save money for themselves, which gets turned into profit for companies like United Health Group, which is on the number 5 on the Fortune 500 companies.
And this is CEOs and board members and administrators not making, a couple $1,000s. These are millions of dollars. That do not contribute a drop into your health care.
That is correct.
It is their pockets and their second and third homes, and it's just horrendous. It's just terrible.
Right.
And I kind of want to do a little bit of switch in the remaining time. Maybe even take a few questions. If you have a question about anything that Carol and I have been discussing, our number here is 967-2201 to go ahead and call in. We have about 10 minutes left. But I just kind of wanted to do a little bit of pivot to what a mess we're in.
Well,
and what can we do other than be more knowledgeable about what's going on, which is a challenge. But just to be aware of where do we need to go? And I don't want to say let's adopt Canada or let's adopt England, because everybody is quick to say, well, they have problems, they have high taxes and things like that. But you pay taxes to get stuff. But anyway.
Right. Well, I'm actually not here to talk about Medicare for all today. That's not,
no, I know.
That's not my goal. Actually, I think we really need to start by first just bringing traditional Medicare into the 21st century and leveling the playing field. I don't think that the Medicare Trust Fund should pay any more for coverage of an enrolled life in a Medicare Advantage plan than it pays in traditional Medicare. And right now, that is not the case. Medicare Advantage, according to not only a report by Physicians for a National Health Program, but just on March 19th, the Center for American Progress had a report. And both of those are saying that we are overpaying Medicare Advantage plans to the tune of between 88 and 140 billion.
I was afraid
with
you were
a
going to
B.
say the B word.
Right. 88 to 140 billion dollars a year. So that's money that is coming out of the Medicare Trust Fund. And what's the Medicare Trust Fund? That's what every single person who's listening who gets a paycheck and has a deduction for, I don't know what they call it. Is it FICA or something? That includes your contribution in every paycheck to the Medicare Trust Fund, which is supposed to be your investment in your health care when you retire and need to continue to have health insurance.
And this is why Medicare came into being.
Exactly.
And Social Security in the mid-60s,
Right.
so that our elderly, sorry,
I'm
elderly too, could have a good life.
Right.
Because as Americans, we need to not just while
Right.
we're working and then
Right.
out the
So
door, but
I think we have to start by leveling the playing field, improving traditional Medicare, allowing so that traditional Medicare has no a cap on out-of-pocket expenses, a yearly cap, so that it includes dental, vision, and hearing, and perhaps include a Part D benefit.
gym members.
I don't really need the gym membership, but you get my point. We could make traditional Medicare more streamlined and include the benefits that younger, healthier enrollees need
And
want, and we could actually pay for that by simply not wasting $140 billion a year on upcoding, and which is that strategy for making people look sicker than they really
look
are.
like lemons,
And
So
gaming the
they're
system.
looking through your records. Medicare doesn't look through.
Medicare doesn't need you to look sicker so it can charge more.
So it's not looking at your medical records.
No.
Where insurance companies do.
Exactly.
And as far as, you sign that when you go to the doctor, that they can send stuff to your insurance, if you have insurance, to make sure that what you're getting is legit. Or why do you need to do this? So
well, I hope we haven't put everybody to sleep, because we haven't gotten any phone calls yet.
Well, many times we don't, and I don't give that number, early enough in the program, because we always have so much to cover.
There is one other aspect of this that I'd like people to be aware of. We started off by saying all of this is very confusing, and I get it. When you're 65 and you're scratching your head and trying to decide what to do, you may go to a broker. Well, you need to understand that your insurance broker can guide you into either traditional Medicare or one of a variety of Medicare Advantage plans. But the way things stand today, that broker is going to make more money if he or she enrolls you in a Medicare Advantage plan in brokerage fees than if they guide you to traditional Medicare. So it's...
Yeah, everybody's wanting a piece of the pie.
Right.
And that affects your health, your very life.
Yeah.
And if you followed the dollar, to just impress upon people, I think if you followed the dollar. Follow the money, and you thought it pays into Medicare all your working life, and then, but that dollar can go into some CEO's pocket. Is that correct?
Yes, that is correct.
You think you're paying into Medicare, but really you're paying a little bit into to some millionaires, maybe multimillionaires' pocket.
Right.
And he's not helping you.
Or Joe Namath's, advertise.
Oh, yeah, Joe Namath.
Joe Namath is making money on this too.
Yeah. Yeah.
So all that glossy advertising, you're paying for that out of your Medicare Advantage
So
premium.
hopefully we've made some people mad enough to
But again, I want to start and end by saying I am not criticizing anyone who
No.
chooses Medicare Advantage. It boils down to, in many cases, it's just a matter of what's coming out of your pocket every month, and I get that. But even if you're in a Medicare Advantage plan, open your eyes, advocate for making traditional Medicare better so that you can just choose Medicare.
And be aware of, things in the news and legislation and
Yeah.
and that you could see some signs and start to learn a little bit about it. This program is recorded. It'll be both on our website, Franklin County, Tennessee Democrat, our Facebook, our website, the newsletter. If you email us at gmail.com, those addresses and that I gave at the beginning, I think we'll sign off and wish everybody good health and happy spring break to the third graders. I know they're not listening. They're back to work, but spring break.
Happy spring.
Thank you. This has been Common Sense Matters from the Franklin County Democratic Party.